So, Andrew, I know because you told me that you are an engineer by background and training. And for many people in the dementia caregiving space, it's a hard leap to go from engineer to dementia caregiving. So you want to show us or tell us how you came from an engineering background to the space that you are now in, and then we'll tell people what it is that you do.
Yeah, so as you said, I'm an engineer. I like things that are logical. That 1+1 is always 2. I expect this repeatable, definitive answers every time. That's how my mind operated. But as my grandmother's Alzheimer's journey was really ramping up, that was not the case, right? In my mind, the logical, rational, objective piece would say we get a clear, definitive outcome. We follow fixed, repeatable steps, and we will get a clear and repeatable outcome that we can really measure and we can track and we can know when we need to fix the output to make it the best possible. That's what I expected. That was the engineering mind in me. But like many, that's not the case, right?
So for people listening, how long did your grandmother live with dementia, and how long were your family navigating taking care of her? Which many people, I have people listening to this podcast, both from the United States and Canada and other countries. But in Canada, the Canadian system is a little different than the American system related to health and healthcare. But how long were you guys in that period where you were trying to coordinate care? So how long did your grandmother live with dementia, and how long were you guys like seriously in the trenches where you were coming up with a tangible solution to a problem that so many caregivers have, which is, how do I actually coordinate this? How do I not, for me, like, how do you not lose your mind trying to make sure that you have all the appointments, who the paid caregivers are coming in, who the family volunteers are, the whole 9 yards. So speak to that for me.
Yeah, so it was a spectrum, and one of those things about care for someone with dementia is you never really know where it starts. Like, what is the starting date of this thing? My aunt was, a full-time caregiver for my grandmother. She was there 7 days a week, easily 80 hours a week. She was there, and my aunt did an amazing job, and I appreciate what she did and how she put, her own life on hold to look after. But that was she could only do that because the care facilities only let one person in, and so she had to be that person. And again, we got this whole COVID dynamics. But my aunt was the one there coordinating everything, navigating it. But as the regulations decreased, we started seeing that we do need to bring more people in. And it started with, let's have people in the community that know her, because where they lived, it was a lot of people that were part of their church.
Mm-hmm.
So which is amazing, right? And my grandparents were on the waiting list for this apartments for like a decade.
Mm-hmm.
And it was all the church community, all went from the church, and then they all moved here, and this is kind of just the flow that they did. So they know all these people, so it's kind of like bring some of those people around and get them interacting as they could with the whole COVID restrictions. And then started bringing in, the community started having companion care people. So volunteers that don't live there, but they're a bit more senior, and they want to come and visit and interact and help support these people. So we started bringing them in, but then we started seeing grandma needs a bit more acute care support. Maybe it's some basic medication, maybe it's the bathing, these sort of things. And then we started bringing people in, and it got to the point where we had like 3 different companion care and 2 different home care over the year. My grandmother passed away in we're May 2026 right now, so it would have been June of 2024.
Okay,
she passed away. 2024. My grandma passed
so
away.
a good solid 3 years of the increasing coordination of caregivers coming in, starting with your aunt. COVID was a little bit of an outlier, but for most normal caregiving situations, for a period of time, one person can do it, and then it starts to incrementally increase. And so
Yeah.
what I hear you saying is you guys were, you recognized everybody, playing whack-a-mole, trying to keep everything going, or juggling balls up in the air, trying to keep everything going. And it was, my words, not yours, but disconnected and not coordinated.
Totally. And so what I noticed and I watched was my aunt, again, love my aunt. She's amazing, but she doesn't come from a background in health.
Mhm.
And so she comes from a marketing background, and that was her experience. And she was doing the best that she could. And I don't know if I could do a better job if I was in her shoes doing things, the same dynamic. But she did things the best that she could. And so she would reach out, like I would go visit grandma later on. Once COVID started lighting up stuff. I would visit her, my wife, my mom, all these people. She would message, how did it go? What did you see? Message to companion care, like what's going on? And she'd try to coordinate this all information. She'd try and track it, build a repository. And then when she meets these care professionals, like, this is what you need to know, this happened. And it didn't always work right because one, you have a non-medical person trying to make a determination of what is important, something that my wife or my aunt or one of these people evaluate and determine is important to you as a clinician might go, yeah, okay, that's normal, whatever, not important. But maybe there's a piece that we don't think is important, but you do. And so ultimately, there's so much subjectivity. So as we're working through these care providers and even to the effect of neurologists and general practitioners and stuff, there was so much subjectivity in it that it makes things complicated and puts seemed a burden on my aunt to try and coordinate with all these people, which is a scattered mess in itself, and then to try and relay the important information is hard. So my aunt would have these binders, and this is the important stuff, and there'd be a binder in the room and all this kind of stuff. And I recognize why that was done, but firstly, got subjectivity in there. Secondly, data insecurity is a problem.
100%. Yeah. So when I was helping my mom, she passed away in February last year. I didn't have a binder. I am a healthcare provider, so I could keep it up in my head, right? But one day I was counting just doctors. She saw 9 different providers. 9, right? Between the dentist, the ear doctor, the audiologist, all of these different providers. And because I know from being on the professional caregiving side, how valuable it is for people to have a centralized place for this information. You said, your beta version, your version 1 was pretty high tech, low tech, right? So not
super low tech. I wouldn't even go high tech. I'd say super low tech.
You understand what I meant, right? It's like what I would be putting together is Google spreadsheets, and
it's still, that's what's funny. It actually started as a Google form and Google Sheets.
I believe it.
That's how it started as.
And then you just kind of grew it from there. So tell people a little bit about what it is that you have built to help family caregivers and other providers coordinate care.
Sure. So let me paint the landscape a little bit here. So in Alberta, we have what's called Connect Care. What Connect Care is in theory, it connects all care, like the name says. So it connects doctors with each other, and when one doctor sees you, the next doctor will see the same information. Great. In theory, it is amazing. In practice, it doesn't work the way that it says, because doctors and select care providers, maybe nurse practitioner or something, can access it. Home care companies do not have access to it. OTs, like yourself, do not have access to it. Companion carers don't have access to it. Families do not have access to it. So this repository of data information on a person in theory works great for sharing, this person's, I don't know, iron is low or whatever. It works great for that. But when we talk about, the intangibles of a person, it really
Mhm.
drops the ball. Um, so recognizing this, I was like, how do we get everyone to communicate? I'm talking about this idea of caregiving islands. Like I said,
Mhm.
my family had my grandmother, who I consider to be in the middle of this island, and all these people on the outside. You have all these companion cares, home cares, me, my wife, my sister, my mom, my dad. All these people are on the outside caring for my grandmother. We all kind of exist on our own little islands.
Mhm.
We're all doing what we think is best, and we try to do our best because that's what family and caregiving is. We try to do the best that we can. But we're not communicating with each other all the time. I mean, I would communicate with my aunt. I would never tell my dad what happened. I never really tell my mom that often. My wife and I communicate a little bit, but all the stuff directly pertinent to my grandmother would be all directed through my aunt. So everything would kind of be this telephone line,
Mhm.
and
Yep.
you have a telephone game and everything gets chaotic and messy. So I was like, why is this the case? And so that was the first piece that led into Connect. And we built the technology, what we call caregiving bridges. So it formalizes and makes rigid these communication processes so that it doesn't matter what caregiving organization you're supported by, we can caregiving or caregiver and companion care, home care agnostic. So if you're cared for by home care company A, home care company 1, and companion care company whatever, and all these families, we want to be able to create bridges across all these islands and recognizing that they all have their own individual systems and softwares and stuff, and that's great. But does the family care about the home care company 1 having their software? Not really. The family says, I want to know what's going on, and I want these other companies to know what you're doing, because if you have best practice, that's great. But simple economics is, law of supply and demand, that we are going to want to figure out how do we drive up demand while decreasing supply. So I am going to try and do what's best for me. And sometimes that's at the expense of these other organizations. So they will do what's best for them. But as a family, what's best for them is not what's best for me.
Mhm.
So
Or
how
not
do I,
grandma.
100%, me as in my grandmother in this context, story. But how do we build something so that we're all working collaboratively? So like I said, we're company agnostic. So we built a system so that all these organizations and all these people can communicate and work collaboratively together. They put information, and home care company 1 and A, I think I used, and whatever companion care name I used, they all can communicate and talk together for a common goal. They can learn what's working, what's not working, and that's important. Right.
100%. Yes.
It's so important.
100%.
So,
So
sorry, go ahead.
what I was going to say is what I find fascinating about what you have built is I know you and I have spoken about this earlier. My view of dignity, order, and truth, right? Your platform provides people with the ability to the word treat, but not medically treat, but interact, work with, be with a person by giving them dignity because it's person centered, right? Understanding then by putting in these recommendations and culture and the support and so on gives people the order because as your brain is changing, there are parts of the brain that aren't working as well. But it's more than just that. It's right. How did we grow up? Where did we grow up? Our culture, our language, etc. So the order, and then it helps it helps for other people who are not in the family system, the ecosystem of the family, who's coming in and providing care to then at their fingertips have the information they need instead of trying to guess all the time what they're doing. Like I was really good at guessing but it's because I could pick up on those cultural cues and I understand different cultures because I've lived in different cultures. But a lot of people, like here in the South, like people just don't know or understand other people, other people's cultures. They wouldn't understand how your grandmother who lived in the First Nation tribe, how she grew up. It would be so foreign to them, they wouldn't even know how to interact with her.
100%. You, you, you hit it on the head. And in Canada, we have this, we're they call it a mosaic. So you have a lot of different folks from a lot of different places. So how do we make sure they're being cared for the way that they need? I mean, so being a Christian, I don't align with what Islam teaches or talks about. But that's not to say that I don't believe that they have or they deserve the right to be cared for. I don't think we should, remove that. I don't think we should also punish them for that. I think we should show God's love by caring for them in the most appropriate way. And I think that is, what are ways of caring for them that are clinically valid, personally specific, and culturally appropriate. So by forcing a 85-year-old Muslim woman to do hot yoga, I don't think that makes sense. But some of these institutions and care models say, that's great, thumbs up, let's do it. And I just don't think that's right. I don't think that's I don't think that's what Jesus would ask us to do.
No. Jesus met us where we are every single time.
100%.
Yep. What a blessing this is. Like, truly, I think the thing that stands out to me is how easy you have made it. You and I were talking before we got on air. I have been involved in the back end, sort of, kind of, over the last several years in several different apps, developers, etc., for caregiving coordination, for lack of a better word. And many of them, I don't consider myself to be a brilliant person, but I'm definitely not stupid. And if I can't figure them out, then it's hard for it. It's got to be easy. Like I always say, it has to be like fall out of a tree easy for people to use, or else you're not going to use it. And so what I really appreciate is how easy this is, because caregiving, yourself, is super overwhelming in a lot of things. But another thing that I truly think that this is a benefit for is many people are holding this information in their head because there's no other place to put it, right? So if we can get some of the information out of our head onto a centralized place, then it'll, one of the big things that caregivers struggle with is decision fatigue. And so making it so that you have a place where everything is centralized will mean that we can decrease the perceived decision fatigue of running all of this in your head by putting it in a centralized place where you then know it is not getting lost.
I have not considered the decision fatigue component of this. No one's brought that up.
See, I'm helpful.
This is brilliant.
But it is. Like, literally, have you not... I mean...
Now you're saying, again, in reflection, I agree with you. I hadn't considered the implications of decision fatigue in this. So, yeah, makes sense.
Yeah, 100%. So something that came up while you were talking is, and possibly these are my words, and maybe this is what it is capable of doing. But I will use, like you and I were talking about my background earlier, right? I grew up in the 1970s and 80s. I'm from South Africa during the apartheid era, right? So now let's go fast forward to 20 years from now when I am living with dementia. My parents lived in 3 different countries, and I have cultural influences from 3 different countries, living in 3 different countries over my formative years. Is the capability of putting in a person's personal history and then having, based on where you as the caregiver is paying attention, they look like they're in this time frame of their life, that you can pull the historical context out.
You betcha. You
Oh,
betcha.
wow.
I mean, the more nuance we get, the more complicated it gets. I can't necessarily, or the tool can't necessarily go and say, 1976, South Africa, this was happening, or 1980, whatever, in Sweden, this is happening. But we can definitely get down the road and help you get towards that. Obviously, nothing is perfect because there's so much subjectivity and,
Oh, yeah,
each
for
person
sure.
is different, but it can definitely point you in the right direction, help you figure that out. But there's also an interesting piece of how do we appropriately reflect people where they're at? Because South Africa, big country, right? Someone from one part of South Africa is not necessarily the same as someone from a different part. So one interesting challenge we have is like, how do we navigate that? So an example I like to use is Goa. Have you ever heard of Goa?
Mm-mm.
Okay, so Goa is on the coast of India. It is a Portuguese colony. So it's a Christian Portuguese colony in India. So they, a lot of them speak Portuguese or English as the first language. They don't really align with a lot of the India cultural beliefs and norms. And it's a very Christian-centric community. So when you look at them and you say, where did they grow up? In India or in Southeast Asia, one of these communities. Great. We would typically say, let's put them in this box over here. But they're in this unique chasm, and this is just one example. There's lots of other. But we can't just paint them in that brush. They're closer to maybe a European,
Portuguese.
Eurocentric model than they are this other one. So it came up with a unique challenge, and this came up because we had someone that went through this, and I was like, I hadn't considered that piece. That's how we came up a couple of years ago, and when this person came through this, I was like, interesting. That's a unique case that is going to have to build out more cases like it. So we're trying to build it as dynamic as possible, and we're continuing to build it out and expand on to make it more reflective of all these unique niche use cases that do come up.
I love that. So this really speaks to me because of what we talked about. Just the more you know of the human in the mix and what they went through in their life, the better you can care for them because you are able to meet them where they are. And this tool sounds like it allows multiple caregivers to have that information in their hands and not all the time be second guessing why this person doesn't want to take a shower because they never took a shower in their life when they were at that age, right? And so we can really manage expectations. Most of dementia caregiving is pattern recognition. And if you can write it down and you can keep it somewhere, you can over time, I guarantee you can find the pattern for what's causing the thing that you see that's driving you nuts. And so pattern recognition, writing it down, having a way to track it, being able to start to put together the pieces will equal better care for the person that you love and are caring for over time. So Andrew, thank you so much for being here. Thank you for being my first interview in a while.